From an obscure and insignificant disease that was known to affect only the rich old people, cancer has now become one of the leading causes of death, not only in Kenya, but also across the sub-Saharan Africa. Recent research has shown that there are more cancer cases being reported in Kenya now more than 10 years ago. But studies to determine the reasons for the increased prevalence and incidence are not being conducted. Increasingly, younger Kenyans are falling victims to the disease, unlike in the past when it was considered a disease of the old. According to recent findings carried out by South Asia's largest cancer network HCG, cervical cancer and HPV cancer is common among women in their 30s and 40s and is mostly caused by females having multiple sexual partners, while for some who engage in sexual activities as early as 16 years.
The carcinoma cervix is most common in terms of all of Africa, because of the multisexual partners is one of the risk factors, and also local hygiene.
And in males, prostate cancer will mostly affect those who feed in a diet high in red meat, and examinations are warning Kenyans to change their lifestyles, especially what they eat.
The prostate cancer is very high in Africa because of the increased consumption of red meat. And even the prostate cancer is a prostatitis, increased infection, which is because of multiple sexual partners, is also a risk factor.
Dr. Dinesh Madhayan, an oncologist at HCG India, says increased consumption of red meat is dangerous and is a contributing factor of cancer. Other foods, for instance genetically modified fruits or vegetables, are also a contributing factor.
Red meat is harmful for different reasons. One is it contains high content of fat. So that increases the obesity. It causes the risk of increase in the colon cancer. You can see a lot of patients who are getting colon cancer. One of the risk factors is increase in the red meat. And smoked meat is also one of the risk of cancer because of the chemicals which are there in the smoke.
Though cancer treatment is improving in the developed world, research has shown that most of the reported cases are diagnosed at late stages when very little can be achieved with therapeutic intervention. This could be as a result of the fact that cancer control, prevention and screening programs have not yet taken root in Kenya, considering the heavy burden placed on the health ministry by infectious diseases. As experts put it, the rising cancer cases is an indication that indeed it is about that time when Kenyans need to change their lifestyles. Josephine Maina, K24 News, Nairobi.